Hello, everybody. Thank you, everyone, for taking the time to join us today for our second series of the Health Talk for Speech Therapy Day 2022. Before I hand the time over to our wonderful speakers, I'd like to share with everyone the house rules for the talk today. If you have any questions along the way, you can use the Q&A button below and type in your questions. Our speakers will address them during the Q&A section. Lastly, please fill up the online feedback form at the end of the session to help us improve for future health talks. Without further ado, let's start our health talk. Before we start, I just want to let everyone know that due to our speakers' schedule clashing, the talk segments are pre-recorded. However, if you have any questions along the way, not to worry. The speakers will be joining us in the later part of today's webinar to answer your questions, so do type them down by clicking the Q&A button below. Just to run through our content for today very quickly, we will have three sections. Firstly, Swallowing Problems in the Elderly, conducted by Ms. Goh Cheng Jee, Senior Speech Therapist from TTSH Speech Therapy, who will share on differentiating age-related swallowing changes versus actual swallowing impairment, speech therapist's role in managing dysphagia, and caregiver tips. Next, we will touch on overcoming malnutrition in the elderly, conducted by Ms. Celia Jong, Dietitian from TTSH Nutrition and Dietetics, who will share on the impacts of aging on nutrition, when to seek help, and optimizing nutrition for modified textured foods. Last but not least, we'll talk about dealing with grief or speech function loss, conducted by Dr. Yang Su-In, Principal Psychologist from TTSH Psychology, who will share on the impact of swallowing and communication difficulties on caregivers and coping strategies to deal with grief and stress. Okay, enough of me talking. I'll now hand over the time to our first speaker for today, Ms. Goh Cheng Jee, Senior Speech Therapist from TTSH.
Good morning all, and thank you for attending our Speech Therapy Day virtual series on swallowing and communication difficulties in the elderly. My name is Cheng Jee and I'm a speech therapist. Today, I will be sharing on swallowing difficulties in the elderly. This is a brief overview of the content that I will be sharing today. To understand swallowing difficulties in the elderly, we must first understand normal swallowing and how it works. In normal swallowing, it involves a continuum of phases beginning from the oral phase, where food is chewed and being prepared for swallowing, down to the esophageal phase, where food and water is transported down to the stomach for digestion. As you can see, the passage leading to the lungs share a close anatomical space with the passage leading to the esophageal. And swallowing involves careful coordination and timing to ensure that food and fluids do not pass into the airway at any time. Swallowing also requires an adequate squeeze of the tongue and throat muscle to ensure that food and water passes entirely down to the stomach rather than accumulating in the mouth or the throat, where it poses risk of it falling into the airway. So breakdown in any one of these phases will result in dysphagia. Age-related changes or presbyphagia also refers to changes in swallowing mechanism of healthy older adults which results in normal aging. And this includes changes in taste, decrease in saliva production, loss in dentition impacting on chewing abilities, reduced strength in swallowing muscle, reduced sensation, and also delayed swallow. As mentioned, presbyphagia is a normal phase of aging and is not to be confused with dysphagia, which is a swallowing impairment. Now, in older adults, they also demonstrate a high prevalence of multiple medical conditions, which could also increase the risk of developing dysphagia. One of the few medical conditions that may lead to dysphagia includes stroke, dementia, Parkinson's disease, skeletal degeneration, and also medication-induced dysphagia, but this list is not exhaustive. So as you can see, age-related changes, together with the high prevalence of medical condition or diseases, increase the risk of dysphagia in elderly. So in the next segment, we will talk about when, why, and where to seek help. When you should seek help, you should seek help if you notice the following symptoms when your loved one is eating and drinking. One of the few symptoms includes pocketing of food in the oral cavity, or refusal to swallow, excessive drooling, or food left in the mouth after swallowing, or it takes an extremely long time to finish a meal, or sometimes if you see your loved one swallowing multiple times in a mouthful, or throat clearing, coughing, choking during or after swallowing, and sometimes you might hear a little bit of a wet, gurgly voice during meals or after meal. And the last few would include shortness of breath after swallowing and recurrent chest infection. And why do we need to seek help? There are many implications of dysphagia to an elderly, and one of which includes loss of appetite, loss of weight, malnutrition or dehydration, aspiration pneumonia, chronic cough and phlegm, and it may also impact on social-emotional impact, where food and drinks and patients are coughing and choking throughout their meals. Where do we seek help? If you suspect your loved one suffering from dysphagia, you should obtain a referral to see a speech therapist. Speech therapists are professionals who are trained to assess, diagnose, and manage dysphagia. You may approach your general practitioner, polyclinic doctors, specialist outpatient clinic doctors such as the geriatric center, or inpatient doctors if your loved one is admitted. Raise your concerns and request for a speech therapist referrals to be made. Now, I will talk about speech therapist's role in assessing, diagnosing, and managing dysphagia. Speech therapists begin with assessment of the swallowing difficulties, and this includes a comprehensive case history gathering, a clinical bedside assessment involving various diet and fluids consistencies, and as well as probably sending a loved one for further testing that may include endoscopy or fluoroscopy if indicated. After the assessment is completed, speech therapists will then come up with an intervention plan to manage the dysphagia, and this includes identification of appropriate modified consistencies, which involve mechanically altering diet texture or adding thickener into fluids. Or there are also some recommendations to strengthen the swallowing muscles, targeting weak swallows, slow or incomplete muscle strength. And also there are onward referral for further medical management, caregiver training, and also possible other considerations to ensure intervention plan is tailored to the individual, such as social support, tolerance, and reception for modified consistencies or non-oral feeding. Now, I would like to spend more time to share on the caregiver role in swallowing difficulties. As caregivers, you spend the most time with these patients. You are best placed to identify early signs of swallowing difficulties. Once patient returns to the community, we will need your help to implement this modification and strategies that were identified to be effective for safe swallowing. Firstly, caregiver roles involves early identification of dysphagia. Be watchful for signs of dysphagia as your loved one ages. Raise your concerns early to a doctor for appropriate speech therapy referral. For patients with known dysphagia, be watchful for signs of worsening of their swallowing difficulties, such as choking or coughing, in spite of appropriate modification and strategies in place. Next, provide appropriate consistencies as recommended by your speech therapist. For diet, speech therapists will advise on the best texture for your loved ones, and this ranges from regular diet, which has no restrictions to size or hardness of the food option, to the softest puree diet, which has to be smooth and lump-free. These are some examples of local food in each categories. Thickened fluid may also be recommended to help with swallowing difficulties. Commercial thickeners are available off the shelf in major pharmacies, but it should only be used on instruction by a speech therapist or a medical doctor. There are also some further tips on feeding consistencies. Avoid mixed consistencies, which consists of fluid and diet in one mouthful, and this includes noodle soup, juicy fruits like orange and watermelon, You may need to strain off the soup and serve separately, or consider blending juice to ensure a single consistency, which is easier to coordinate and to manipulate the fluids. Avoid food that will melt easily, especially for patients on thickened fluids, as these may cause them to cough or choke. Slippery food, for example, 𝗢𝗱 or agar-agar, or sticky food like glutinous rice or sticky kueh, poses high risk of choking for patients with swallowing difficulties, and this should be avoided or served with care to your elderly. When in doubt, please consult your speech therapist before serving. Next, caregiver roles in managing swallowing difficulties also involves implementing safe feeding precautions. While these tips are developed for patients with dementia, it can also be helpful for the general elderly population with swallowing and/or cognition decline. Firstly, patients with reduced feeding response or alertness, get patients to do some physical movement before feeding to increase alertness and responsiveness. For example, by walking to the dining area. However, do avoid strenuous exercise that will lead to fatigue before feeding. Also, you can consider using food that heightens senses, for example, cold or carbonated drinks. Next, for patients who are easily distracted or agitated, do not pressure them to eat if they are agitated or in distress. Minimize distractions such as turn off TV, sit in a quiet area, provide redirection to feeding tasks if distracted. Keep eating simple by providing one food at a time. Next, for patients who experience loss of appetite, provide structure by having meals at the same time each day so that eating becomes a part of routine. Make every mouthful count by increasing calories or use milk supplement. Make food look and smell more appealing. You can try and explore different tastes, smell, or color, or you could try familiar food or taste. Make mealtime relaxed and simple. Provide several small frequent meals throughout the day. The next thing caregivers should do for a loved one with dysphagia is to provide oral care and oral hygiene. Do not neglect to clean your loved one's gums, tongue, cheek, and roof of the mouth if they have no teeth and if they are on tube. This is especially important when they are on tube feeding and they are edentulous or on dentures. This lowers the risk of chest infection from harmful pathogens in saliva entering the airway. Good oral care has been shown to improve swallowing safety and nutritional status. Caregivers should encourage twice daily brushing. As mentioned, this is important even if your loved one has no teeth or is on tube feeding. Encourage gargling post-meal where possible, or remove food particles with oral swabs or wet cloth if your loved one is unable to gargle. Do take note if your loved one is on thickened fluids, you may need to use an oral swab instead of gargling. Keep the oral mucosa moist and take note of any abnormalities in the oral cavity, such as crack, dry mouth or ulcer and thrush. In terms of denture care, ensure that dentures are fitting. Apply dentures adhesive if it's needed. If the dentures are no longer fitting, they may cause pain or problems when eating. Remove the dentures and provide softer food if needed. Remember to remove the dentures after meals, clean it with a brush and rinse it with water. Do not leave dentures in the mouth overnight. Gently soak it in cleanser at night. Lastly, here are some general tips to optimize your loved one's experience at mealtimes. Use colorful food plates that have high contrast against the table or bright lights for elderlies with fading vision. Add spices and condiments for elderlies who are losing their sharpness of taste. For elderlies with dry mouth, ensure good oral care, moisture food as necessary, and encourage frequent fluid intake. Thank you for your time and attention, and I'll look forward to addressing your questions in our joint question and answer segment later. Thank you.
Okay, thank you, Ms. Goh. We will now move on to the next talk segment, This portion will be covered by Ms. Celia Jong, dietitian from TTSH Nutrition and Dietetics Department, to share how we overcome malnutrition in the elderly.
Hi everyone, my name is Celia and thank you for having us a part of Speech Therapists Day. Today, we will be discussing on malnutrition and how it impacts the elderly in our population. Also, we shall discuss some of the strategies that could minimize the impact of malnutrition in elderly who are on textured modified meals. A bit of background. In 2020, 17% of our population is 65 years and above. This will be projected to increase to 24% in 8 years' time. Malnutrition is usually not recognized and undertreated in the community. From a 2017 study, 30% of Singapore elderly are malnourished or at risk of being malnourished. Malnutrition develops when the body does not receive adequate protein and calories to maintain healthy body function. Some signs of malnutrition include the lack of appetite, fatigue and irritability, constant illness with longer recovery time, difficulty concentrating, constantly feeling cold, and a loss of fat, muscle mass, and body tissue. Malnutrition can result in higher risk of falls, poor healing and increased infections, higher risk of post-surgery complications, as well as longer hospital stays and frequent readmissions. Some common challenges elderly face that leads to malnutrition includes the following. However, it is chewing and swallowing difficulty that we are focusing on today. While there are technical ways to overcome chewing and swallowing difficulties, like ensuring proper dentition, sitting upright, reminding to chew, swallow, and drink slowly, as well as getting the recommendations from a speech therapist with regards to the textured and modified meals. Today, we will be discussing on how to improve our nutritional intake if we have chewing and swallowing difficulties. We do so by food fortification, nourishing fluids, high energy and protein snacks, as well as preparing attractive and flavorful meals. Food fortification. To increase the nutritive value of food without increasing its portion size. Here are some ways to increase the calorie content of oats. Instead of preparing oats with plain water, we can boil them in full cream milk to increase its overall content. Additionally, we could also add honey or peanut butter into our oats to increase its overall nutritive value. With porridge, here are some ingredients that are high in protein that we can add on to. Biscuits too can also be increased in calorie content before being soaked in milk or fluid to soften the texture. For low-calorie foods, here are some toppings to increase the energy content. We can also add on to our dairy products like the following to increase its calorie content. Lastly, with dessert, we can increase its calorie properties even more with adding extra toppings or ingredients. Nourishing fluids. Drink adequate yet nourishing fluids throughout the day to increase nutritional intake and to ensure enough hydration. Remember to schedule fluid intake after meals, as too much fluid with meals may make you fuller. For low energy beverages, here are some examples to increase its calorie value. High energy and protein snacks. They can be provided to make every mouthful count. Small, frequent meals will prevent overwhelming the elderly to eat large amount of food at one serve. Here are some examples of snacks that are high in energy and protein. More examples of high energy and protein snacks that could be included in between our elderly's meals. Lastly, to prepare attractive and flavorful meals. We can use food molds to mold food into their original shape so that it looks more attractive. Also, we can add herbs and spices to enhance the smell and flavor of meals. The above strategies do not help with weight maintenance or improving your overall nutritional intake. You can consider taking oral nutritional supplements. They are specially formulated beverages that contain energy, protein, vitamins, and minerals. They are used to supplement nutritional intake when someone is eating poorly during meals. Do consult with your doctor or dietitian regarding the consumption of oral nutritional supplements. In summary, malnutrition is prevalent in Singapore, but it is reversible and preventable. Ensure that you have adequate nutritional intake to prevent malnutrition. Ensure you have adequate energy and protein intake, which are important for muscle, strength, and immunity. We can increase our nutritional intake even though we have chewing and swallowing difficulties by food fortification, including nourishing fluids, have high protein, high calorie snacks in between our meals, as well as preparing attractive and flavorful meals. Thank you.
Okay, thank you, Ms. Jong. Our final speaker for today will be Dr. Yang Soo-in. She's a principal psychologist from TTSH Psychology. She'll be ending today's talk by sharing with you how to deal with grief or speech function loss.
Good morning, everyone. Thanks for joining us today. In celebration of Speech Therapy Day 2022, I'm going to bring you on a little journey, considering how we can deal with grief that comes with speech function loss. A journey that considers the function of communication and its importance to us, types of common speech disorders and how they disrupt processing of speech, and awareness that with any loss of function, be it for that person or for our loved ones, a grief process often follows, quite similar to grieving for someone lost as a result of death. And finally, learning how to support yourself and your loved one along this journey. Why do we communicate? Well, I think many of us want to seek and convey information. We want to satisfy some of our needs for social interaction, through self-expression, like when we observe a play, as a means for reasoning and problem solving, and a means of projecting creativity, imagination, and entertainment, just like stand-up comedians do. Many of us may consider communication to be one where we open our mouth and words are naturally uttered. This would mean communication involves only a two-step process. The full process of communication actually takes 7 steps. And speech can be disrupted at any point within these steps. When someone says something to us, we first hear it, then we have to remember it, and then understand it before we can even find the words to form a sentence together, and we need our brain to tell the muscles how to move to articulate the words before we can even say the words in response. So communication is actually quite complex. And many of us may take communication for granted since it seems like an automatic response. Communication can, however, be disrupted, usually as a result of medical conditions such as stroke, traumatic brain injury, progressive neurological conditions, types of cancers, dementia, and other causes, including mental health such as selective mutism. Think back to the last time you might have lost your voice due to a sore throat or flu. You may empathize then how disrupted communication can affect many aspects of a person's life, relationships, holding down a job, even social activities. Emotions such as frustration, anger, anxiety, and depression are expected common emotional reactions. So what happens when there's disrupted speech at the different levels? When speech is disrupted at step 1, at the point of hearing it, this is likely due to a sensory difficulty. At step 2 and 3, disrupted communication is likely due to cognitive issues. Remembering and understanding speech or communication becomes a challenge. At step 4, there are challenges with word finding, and this is usually associated with aphasia. Receptive aphasia usually involves difficulty with understanding spoken words and or reading. Expressive aphasia usually involves difficulty with talking and or writing, and they can come in differing severity, from few words being mixed up to being unable to say any words. But do know that intelligence is not affected. At step 6, dyspraxia disrupts our ability to tell muscles involved in speech function to move. Dysphonia and dysarthria can prevent us from saying the words. A person can have more than one step of their speech and communication disrupted. Kubler-Ross 5 stages of grief cycle is widely referenced in relation to loss, to death, and dying. Individuals who are going through other forms of loss, such as loss of function, loss of lifestyle, loss of job, loss of financial stability, etc., would often experience similar grief stages. The stages are not consecutive, and individuals can jump from one stage to another in no particular order, and may also remain at any stage without reaching acceptance. For example, someone can just stay and remain in denial stage, not really moving to depression. Some people can go through denial, anger, and maybe just jumping to acceptance. Some people may stay at depression, going back to bargaining, going to anger, and then going back to depression again. So there's really no hard and fast rule of how someone goes through this roller coaster ride. At the denial stage, at the bargaining stage, sometimes directing requests to a higher power of something bigger than us may be able to influence a different outcome, or so we think. That's why we bargain. And for depression, we may start to feel low in mood or depressed when reality sets in. And acceptance is not that we no longer feel the pain of loss. Instead, we stop denying reality and fighting to change the situation. When an individual loses their speech or communication function, or when this function is reduced or altered, it's not only the individual who suffers, but the loved one or caregiver as well. There's a mirror effect in which the affected person and their loved ones go through similar experiences. Some common cognitive and behavioral reactions include avoidance of experiences of grief, loss, use of distractions, minimizing the effect, asking why me or why he or she, fear or chronic rumination, often leading to disrupted sleep patterns as well, and sometimes even social isolation or self-isolation. Some of you joining us today may appreciate that emotions such as frustration, anger, sadness, depression, anxiety, and even feelings of numbness may be experienced. Usually when we are unable to identify or label emotion, we may say we are numb to it. Basically an expression of helplessness, combined with resignation, combined with a sense of, I'm fed up, I can't be bothered anymore, potentially an element of passive acceptance. Prolonged grief at any stage is not helpful to adaptive coping, and allowing us to move on and grow from the unforeseen circumstances of which we have no control over. You can choose to support yourself by first seeing value in yourself as a person, acknowledge difficult emotions, allow yourself to go through the grieving process of loss, allow time to deal with the distress brought by change, allow your loved ones to support you, and this is really very important. Sometimes we think we should just go through the journey by ourselves. Maybe it's due to guilt. Consider what living well means to present you. That means you in the present time, not you in the past. Move away from comparisons with the past, what you used to be like before the condition happened, before speech was disrupted. Notice your strengths. Often we tend to focus on weaknesses, and that's quite a natural human tendency. Build meaningful changes in everyday life and celebrate small successes in knowing that going through this journey, you don't have to do it by yourself, but asking someone that you trust and able to share this journey with you will actually be more powerful. If you are a caregiver and you want to support your loved one, do believe and know that life can and should still carry on. It's okay to continue with your daily activities and also enjoy time out with friends. Feeling guilty and wallowing in the situation is probably not the most helpful way to support your loved one through the healing process. As a caregiver, you can acknowledge your own grief or loss, form your own support network, value your loved one as a person beyond the disability, give your loved one time and space to grieve, be realistic of recovery goals, pace your own expectations of recovery with that of your loved one. Don't try to rush it. Be present and available. Sometimes we don't need to say anything. We just need to be present for our loved ones to know that we are there for them whenever we need them, unconditionally, whenever they need us. Provide support rather than sympathizing or showing pity or trying to solve their problems. Learning to sit with silence or to sit in silence, slight difference there. Acknowledge your own limitations. Talk about hopes and achievements through drawing, gestures, pictures, and writing keywords. Remember that communication is not just speech. There are still many ways to communicate and have a meaningful conversation. It's about shifting our mind to be able to learn and adapt to new ways of communicating. So for example, here, you see facial expression as one. For example, if I'm doing this, you can tell I'm quite happy. I'm doing this, probably sighing, a bit sad. Through touch, through eye contact, through body language, drawing, gesturing as well. Whether you're the individual having to face and manage change, or you are the loved one supporting your loved one through this challenging situation or period, this note applies to you. At the end of the day, these little reminders can be used as small pick-me-ups throughout the day when you start to feel low, helpless, worried, and fearful. Show yourself some compassion by telling yourself you are doing the best you can, you are capable of amazing things, your feelings are valid, you are worthy and lovable. It is okay to start over and try again. It is okay to ask for help. Your boundaries are important. You're allowed to say no. And I think this applies not only for someone going through speech difficulties or for a carer or loved one, but anyone in this room that may not even be facing any of these difficulties. And sometimes it's about that gratitude, that self-compassion, and a willingness to say, hey, you know, I'm human, and a willingness to treat ourselves well, and really to believe that it is okay to start over and try again. And I thank you for your time. I'm so sorry, it's just a very short time and it was a whirlwind journey, but thank you for staying with me.
Thank you, Dr. Yang. With that, we have come to the end of our sharing segment. Our speaker representatives are here with us today to answer your questions now. So please keep the questions coming by typing in the Q&A button below.
Okay, can everybody hear me? Right. Okay, so the first question provide the same amount of energy as freshly prepared food. Um, okay, so if you're getting the frozen food as your main meals, for example, those frozen meals that you get from Cold Storage or 7-Eleven, yes, they do have the same amount of energy. Yeah, so that's one of the question. Secondly, are there any recommended herbs and spices to use for elderly, or any herbs and spices that suit the elderly's taste will do? So yes, so anything that your elderly prefers to have in terms of herbs and spices, then you can use. So sometimes we use sesame oil because most elderly actually are okay with it. And then if of course with a different culture and race, like the curry spices, the more spicy ones, if the elderly prefers that, you also can add to your meals lah, to enhance the flavor and the smell. Okay, to Miss Jong, will drinking supplement milk for nutrients contribute to diabetes since it is quite sweet? So, with regards to the oral nutritional supplements, we do have some supplement milk that are suitable for diabetes patients. So, so you have to get the doctor's advice and see the dietitian lah, especially. Thank you for sharing. You're welcome. If I'm consuming frozen foods, can I fortify them the same way as fresh food? Yes, you can. So, uh, maybe if you're getting ice cream, then oh wait, can you fortify them the same way as fresh milk? Yes, you can. You can add honey, you can drizzle, yeah, like drizzle honey and stuff like that. Okay, the last one I have is for elderly that refuse drinking thickened fluids and get dehydrated. Oh, is it all right to give them normal water? Maybe the speech therapist.
Hello, hi. So for the question for elderly that refuse drinking thickened fluids and getting dehydrated, is it all right for us to just give them normal water? But ideally, if it's possible, we can consider some naturally thick fluids. So it depends on what the consistencies that the elderly require. You can, for patients who are perhaps at their mildly thick fluids, for example, you can consider things like thick barley drink, for example. Sometimes some yogurt, if it's a thicker one, or milkshake. There are also some soups that are a bit thicker, like your cream-based soup as well, that are generally a bit thicker. But if you're looking at the safety wise, it is actually not okay to give them normal water. But it also varies across the individuals, depending on what sort of risk they are able to take as well. Because if your speech therapist have already prescribed the thickened fluids, there are probably some level of risk involved in taking thin fluids or your normal water per se.
Yeah, I think for the remaining questions, our speakers have answered them by typing the answer. So if you have any questions, do keep them coming. Maybe we'll leave about 1 to 2 minutes more for anyone with questions.
With regards to the question, are there any programs that I can bring my loved ones to attend to support the loss of speech? It depends on what sort of speech loss are there. We do have Chit Chat Cafe that's available right now that is supporting mainly the stroke patients, but we do have some dementia patient, some progressive aphasia dementia patients for attending as well. But it really depends on what sort of speech problems there are. We do have our Parkinson's patients who are actually attending the Parkinson's Support Society as well. So I think it would be best to perhaps get in touch with your speech therapist so that we can kind of direct you as to which support group would be better. We also do have the MND support group, so the motor neuron disease support group as well for patients of motor neuron disease. Okay, I think we got another question about what's the difference between 𝗕𝗓 and resource taken up. So essentially between 𝗕𝗓 and resource taken up, they are both different types of taken up. There are different properties as well. So in the traditional 𝗕𝗓, the one with the green color background, these are actually starch-based thickener. And meanwhile, for resource thickener, these are actually gum-based thickener. So essentially, they are both they do the same thing. But with 𝗕𝗓, because of its property of starch base, it does thin down over time as well when it touches your saliva. Because like with all food, starch will break down when it contact our saliva. So I think most of the major hospital have already moved towards the gum-based thickener, but there's no right or wrong or which one is better against the other. It's just making sure that before you feed the elderly or your loved ones, just make sure that the fluids is taken up according to the consistencies that's required. We have patients who prefer the starch-based one because it's less gluey. But we also do have patients who like the resource thickener ones because it doesn't have that starch grainy kind of texture. I'm also going to talk about the question, are there any tips for caregiver support to take care of elderlies from speech function loss? I think that back again, we're going to talk about like speech function loss. It varies across the different types of disorder. So we can have a range from, let's say, a post-stroke speech problems, or it can be a language problems, which I think oftentimes people confuse between if it's a language problem or a speech problem. So if it's a language problem, we probably will have the elderly post-stroke, for example, to be speaking in very short phrases. They may have a lot of word finding difficulties, for example, in substitution. But else for speech function, like Dr. Yang has mentioned earlier, where you kind of need to program the words and then to articulate it out, that sort of coordination may result in speech function loss. And one of the speech problems would be dysarthria, where you have slurring of speech, the speech is very unclear, or it's very soft, very muffled. We also do have apraxia of speech, where the individual knows what they want to say, but it comes out differently from what they expected. So it depends on those various types. So patients with, for example, Parkinson's disease, more often than not, they do have more speech problems than the language function loss. Patients with dementia, they have more of, because of memory issues as well. They do have sometimes word substitution or word finding problems. We don't normally find speech losses in our patients with dementia, unless there's also some other underlying medical condition. So in the general rule, in terms of taking care of elderly with communication problems, perhaps if I were to just lump it up, is to make sure that you are talking at the eye level. That's number one. Number two, making sure that your questions or the things you want to tell them is very short and concise. Taking note as well for elderlies, they do have quite a fair bit of hearing impairment. So all your high frequency words, for example, your S, for example, it is going to be a little bit difficult for them to hear as well. So maybe you might want to bring down your volume a little bit, speak a bit louder. you might want to consider maybe a communicator as well so that they can hear you a bit clearly. Try not to have so many things happening around or having many people talking at the same time. This is going to kind of make them lose focus as to who is talking and all the different noises that I can hear partially, and I'm not sure how to then make it up into something meaningful of what you're trying to tell me, for example. So those are a few things you might want to consider. We do have elderlies with memory losses as well. They are still functioning, perhaps quite independently in a way. You might want to consider maybe some visual memories, visual cards as well, so that they can remember the things that they need to do as well. Hope I've answered that. But if you do have further questions, let us know.
Yeah, just adding a little bit more onto what Cheng Jee has mentioned. I think it's other for caregivers. Sometimes we kind of forget about our own presentation to our loved one. And it's important to also note our own non-verbal response, to really be patient, to show that we're not trying to rush our elderly. We're not trying to give the sense that, we are going off somewhere. And I think that's very important. The eye contact that Cheng Jee mentioned also will be very important, that gesture of just holding the hand to assure your loved one that, hey, take your time, and it's okay to just be a little bit slow with communicating, or even if you can't communicate, I'm there to support you. I think that's very important.
Thank you very much to all our speakers for answering their questions. Do know that if you have any other questions, just feel free to type in the chat, and our speakers will continue to answer them via the type function. So thank you everyone. We have come to the end of our talk. Hope this session has taught everyone more about swallowing, nutrition, and mental wellness in our aging population. Before you go, we want to hear from you. You can scan the QR code shown on the screen right here to share with us your feedback, or click the link in the chat box. So for those that missed out the QR code or are unable to access the form, no worries, we'll share with you the form via email after the event. Our last virtual talk for 2022, it will be happening on 14 December, next Wednesday, called TCM Approach to Neck Pain and DIY Acupressure Exercise, conducted by our TTSH acupuncturist, Mr. Derek So. So if you're interested, the link will be in the chat. Registration will close on 12 December. With that, we have come to the end of today's Health Talk session. Thank you everyone for joining us today, and we look forward to seeing everyone at the next talk. Till then, have a nice day and goodbye.